Hi, my name is Dr. Rudra and through the Oral Health channel, today we're going to be talking about low-level laser therapy in the treatment of temporomandibular disorders. Let's start. So in today's episode, I'm going to be talking about temporomandibular disorders. That means these are temporomandibular joint disorders which can be broadly classified into either rheumatoid arthritis or osteoarthritis related pain, disc displacement with or without reduction, and you have myofascial pain. Now these are a group of collective disorders which basically are located around your temporomandibular joint, where you can feel a lot of pain, a lot of stress in the joint, lack of mouth opening, trismus, and also the fact that it ends up locking after some time of opening, and there can be pain on opening or closing, and lateral excursive movements and clicking and popping in the temporomandibular joint. Now there have been a lot of methods, non-surgical, conventional, medicinal, and surgical as well, to make sure that the TMJs are the TMJ disorders are treated. However, a novel method which is a low level laser therapy, that means laser therapy on a lower level of the wavelength and the energy. How does low level laser therapy work? It's very simple. Wherever there is inflammation, you will have some chemical mediators of inflammation, some sort of inflammation present in that area, and that's where the low level irradiation of the infrared wave of the the lasers, that helps in decreasing the inflammation, decreasing the neurogenic stimulation. The nerve fiber transmission goes less, they increase the action potential, and there is decrease in the chemical mediators of inflammatory, the markers that are released, they are reduced with the help of the low level laser energy, and that's why you get relief. And how it is done usually in almost 3 sittings per week for a month, and of cycles of 30 seconds, where it is placed around usually the joint area. One area is the anterior of the external auditory meatus, one is inside, and on the inside, upon the palpation of the muscles of mastication, wherever you feel that the pain is present, or that those joints or the muscles are tender, and we palpate those areas, and thereby we irradiate the area with 30 to 60 seconds of the laser. That depends upon different treatment protocols, for about 3 sessions per week for a month, because you have to keep 72 hours of gap time between 2 sessions. And on top of that, you have to make sure that the patients are taking anti-inflammatory medications and doing physiotherapy exercises for better mouth opening. And it has been found, despite a lot of studies being done and some of them saying that it's not as effective as other methods, it has been shown that the VAS scale, that is the visual analog scale reading of patients, of discerning and telling how bad the pain is on the intensity, reduces by the 15th day, and especially around the last lasing session. So I would really request you that if you have access to a dental laser or a diode laser and a dentist who knows how to use the LLLT, and if you're having these problems, you should visit your dentist and make sure that you get the treatment done, which is a very non-invasive method without having any sort of side effects whatsoever, and it is a better way to help you get alleviated of your pain, and the mitigation of the pain is something that would help you in your overall quality of life. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message with your name, location, and the common oral health problem that's causing you pain or discomfort, and I'll get back to you within a couple of days. And if you have any queries, doubts, apprehensions, insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.